Welcome. This session is all about stigma and how we as individuals and as society communicate stigma, especially in the context of pregnancy, and how we can avoid communication of stigma in working with our clients and patients. The truth is, society takes a very dim view of substance misuse and addiction. This negative perception is multiplied many times over when the individual who is misusing substances happens to be a pregnant woman. So what is behind this stigma? First of all, addiction is a brain disorder. But in the United States, many people believe that addiction is more of a moral problem, that people with substance use disorders are making a choice to continue using and misusing substances. People with a substance use disorder are blamed for their problems, and unfortunately, many people with a substance use disorder most likely have internalized the negative perceptions that society holds. Thus, the stigma against substance misuse creates internal shame, guilt, and fear. Now, when it comes to pregnant women, we reinforce that negative stigma. We reinforce the shame, guilt, and fear by lodging criminal charges against an individual who's pregnant and misusing substances. So what does research show? In a national survey, 62% of people would work with someone with a mental illness, but only 22% would be willing to work with someone with a substance use disorder. 64% of people believe employers should be able to deny employment based on an individual's addiction, but 25% believe employers should be able to deny employment to those affected by a mental illness. And 43% oppose giving individuals with substance use disorders the same health insurance benefits as those granted to otherwise healthy people. So how do we communicate this stigma on an individual as well as a societal level? Criminalization is the first response when you ask what should we do about substance use disorders. And it's frequently noted that national policy focuses on reducing the supply or the ability to access substances rather than looking at the root cause of addiction disorders. Secondly, we often interpret relapse as a sign of failure, failing to recognize that relapse is part of the addiction and the recovery process. And finally, on a daily basis, we use language that communicates this stigma. So what can we do about this as individual practitioners? We have to remember and we have to understand that words matter. So let's look at some stigmatizing language that currently is often used and offer some preferred language to substitute. For instance, the term addict could become a person with a substance use disorder. Instead of saying an individual is addicted to heroin, can we say an individual has a heroin use disorder? Addiction should now be referred to as substance use disorder. An alcoholic is a person suffering from alcohol misuse. Someone who is clean actually is someone who is abstinent from substance use. A clean screen indicates an individual is substance-free. And certainly, we can stop using the term dirty and indicate instead that this individual is actively using. In that sense, an individual with a dirty screen becomes an individual who is testing positive for substance use. A drug habit can be referred to it as an individual who is regularly using substances. A drug abuser is a person who uses drugs. A reformed addict or alcoholic becomes a person in recovery. Opioid replacement becomes medication-assisted treatment. And a recreational or casual user is a person who uses drugs for non-medical reasons. Does this all really matter? The answer is yes. Research shows that we can change the self-perception of an individual. We can change and move away from the shame, fear, and guilt that these individuals feel when we work on our own approach to reduce stigma. We can treat people affected by a substance use disorder with respect. We can learn about the science of mental health conditions and substance use disorders. We can correct others who have misconceptions about substance use disorders and mental illness. And we can support resources for people affected by substance misuse disorders. When we move in this direction, when we as individuals, as practitioners, as members of the public, move away from stigmatizing language, we do, as I noted, reduce the fear, shame, and guilt individuals with a substance use disorder feel, and that leads to higher rates of entry into treatment. And we know that when an individual successfully participates in treatment, we get significant improvement in long-term outcomes. For instance, the pregnant individual who enters treatment during pregnancy shows significant reductions in the rates of preterm delivery, abruptio placenta, stillbirths, and maternal deaths. For the child, there are significant reductions in the rates of prematurity, low birth weight, newborn seizures, intellectual disabilities, and the early recognition, assessment, diagnosis, and treatment of children who have been prenatally exposed enhances their long-term developmental trajectory. We can make the difference in the lives of individuals, pregnant and parenting individuals, children, by changing our habits, by changing the way we look at substance use disorders, and certainly by changing the language we use. Our job, whether we work in child protection services, healthcare, social services, our job is to help people move to choose treatment. And we can do that by reducing our communication of stigma, both on an individual basis and on a societal basis.